I've noticed this itchy circular rash on my arm for a few days now. It started small, then got bigger, and there's a kind of ring shape to it. That could be ringworm, aka tinea infections, a common infection caused by a fungus, not a worm. A fungus? So what exactly is ringworm? Ringworm is a fungal infection of the skin. The fungi that cause it are called dermatophytes. They thrive on keratin, a protein in your skin, hair, and nails. There are different types depending on the part of the body that is affected. Some common types of ringworm are Adler's foot or ringworm of the foot, Jock itch or ringworm of the groin, ringworm of the scalp or tinea capitis, and ringworm of the body or tinea corporis. I see. So how is it spread? The fungus is easily passed from person to person by contact with the infected skin, objects, or surfaces. It's possible to get ringworm from having skin-to-skin contact with someone who has it, petting an animal infected with ringworm, touching soils infected with ringworm, using uninfected objects like a phone, comb, or towel. The fungi that causes ringworm can live on any infected objects like clothing, hairbrushes, and sport equipment for a long time. And what are the symptoms I should look for? You can get ringworm anywhere on your skin. Symptoms typically include redness, itching, discomfort, and a ring-shaped rash around normal-looking skin. The infections usually start as flat, scaly spot with a raised red border that spread outwards in a circle. The border may be scaly, blister, while the center often becomes more normal in appearance with fine scaling. If it's on the scalp, you may see scaly patches, broken hair, bald spots. If on the nails, thickening, discolorations, and brittleness. That sounds like what I have. So how do you treat it? Treatments depend on the location, severity, and how widespread the infection is. Topical antifungal creams or ointments are first line for most body ringworm. Apply directly to the affected area, usually twice a day for 2 to 4 weeks. Oral antifungal medications might be needed if the infection is extensive, doesn't respond to topical treatments, or is on scalp or nails. For scalp ringworm, often antifungal shampoo may be recommended in addition to oral meds to reduce spread. Make sure to continue the treatments for the full durations even if rash looks better sooner. Stopping early can cause recurrence. Clean and dry the affected area. Moisture promotes fungal growth. How can I prevent it or stop it from coming back? To prevent ringworm, you should shower or bath daily. Dry your skin thoroughly between your toes and skin folds. Avoid sharing personal items like towels, brushes, clothing, bedding, or headphones. Wear sandals in public pools and changing rooms. Wear loose clothing made from breathable materials that draw moisture away from the skin. Avoid clothing made from synthetic material. Change your shoes each day and allow them to dry out. Wash towels, bath mats, sport clothing, socks, and underwear regularly in very hot water and dry them well. Regularly wash floors where you walk with bare feet. That was so helpful. Follow Selenethenurse to learn more about your health.